Hello everyone, my name is Justina Kopek and I am a healthcare technology consultant at MACRA Technology, and I also have Vida Giacomovic with me, who is a healthcare technology engineer, and to join today's webinar. For today, it's the third part of our MACRA series, and today we're going to cover advanced APMs, and APM stands for Alternative Payment Models. Now we'll go ahead and get started, and I'm going to hand it over to Vida. Thanks, Justina.
Good morning, everyone, and as Justina mentioned, thank you so much for joining our MACRA webinar. So in the previous webinars, we covered what MACRA is, gave a brief overview of it, and then we took a deeper dive into Pathway 1 of MACRA, which is your MIPS. So today we're going to cover the advanced APM. By intention, an advanced APM is not just a fundamental change, but it's a change in how we receive and provide health care. So we're going to take a deeper look into that. So as I mentioned in the previous webinars, we covered MACRA Overview. Just a brief reminder for those of you that may have missed it, MACRA has two pathways. So the first way to meet MACRA is via participation in MIPS, and that's a combination of your meaningful use, value-based modifier, physician quality reporting system, as well as your CPIA category. The second pathway or roadway to meeting MACRA is an advanced APM, and the providers can choose between the two depending on which pathway they think they would be able to meet better or qualify for and participate in one of these starting January 2017. Okay, so at this time we're going to offer just a very quick poll question to you, and Justina is going to throw that out there.
So our first question is, do I have to do MIPS if I am in an APM? Okay, so it looks like everyone in attendance thinks that you do not have to do MIPS. You can meet MACRA with any alternative payment model. So this was kind of a trick question because right underneath that it says that you can meet with an advanced alternative payment model. So the difference is that there are alternative payment models out there that are actually not considered advanced alternative payment models. There is a difference, and they must be qualifying in order for you to be able to meet MACRA. So for 2017, there are 6 qualifying advanced alternative payment models, and Vida is actually going to go over those with us shortly.
Okay, thank you, Justina. So advanced APMs, or to translate this, advanced alternative payment models, the second program is generally for those participants who bear risk in the program. So you have money on the table generally with CMS. And so today we'll discuss how CMS structures and defines these advanced APMs and look into the APMs that are available in 2017, as Justina mentioned. So before we take a look into those, let's quickly see who MACRA is going to affect. So generally, if you're an MD, a DO, a nurse practitioner, a clinical nurse specialist, certified registered nurse anesthetic, a certified nurse midwife, or a psychiatrist, you have to do MACRA, and that's via the APMs or the MIPS track. So in terms of whether or not you're going to be affected by it, if you're one of these physicians and you participate in ambulatory Medicare Part B, you would have to participate in MACRA. There is a statute to add more eligible clinicians to this list within the first 3 years of the program. So if you're attending this webinar and you don't see your specialty in here or none of these apply to you, that does not mean that you're not going to have to do it. The final rule comes out on November 1st, and this list very well may be expanded. So we'll keep you posted and up to date if there are in fact more physicians that are added to this list. Okay. So next, we're going to throw out another poll question to you.
Okay, so the question is, are physical therapists subject to MACRA in 2017? Okay, so the majority of the votes came in, and it looks like all of you think that physical therapists are subject to MACRA in 2017. That was actually another trick question. They are not subject to MACRA in 2017. However, going forward in 2018 and 19, they're adding more clinicians to the list. So if you have a physical therapist in your office, that doesn't mean that you shouldn't start preparing for MACRA yet just because your physical therapists aren't subject to MACRA in 2017. The earlier you start preparing, the better. So keep up with the rule and find out when your clinicians are going to be subject to MACRA and start as early as you can.
Okay, so let's take a quick look at the MACRA timeline. Okay, and that's the very third portion here that I have highlighted. So as you can see, in 2016, your meaningful use, your PQRS, all of those activities sunset and are no longer, and then starting in 2017 is when you have to decide whether you're going to be participating in the MIPS or in an advanced APM. So if you have not already registered for any APMs, you're probably going to have to take the MIPS route during the first year of participation, but that doesn't mean that you can start later on in future years. In fact, just from having kind of explored the program and, and taking a look at it, an advanced APM, if you can qualify, is probably a better route, and I'll explain why just very shortly. But for the most part, it's not a sliding scale. With MIPS, where you're doing all the meaningful use in PQRS and value-based modifier combined under that one umbrella, it's a sliding scale. So essentially, you're compared to other physicians and their performance, and that's what your incentive or a penalty is based on. With an advanced APM, there's no such sliding scale. There's a performance threshold that's set up, and if you perform well, you're pretty much going to receive an incentive payment of 5% and upwards for the first few years of the program. And you are excluded from MIPS. So generally, if you qualify and you can participate in advanced APM, it's probably a slightly better model and an easier model to meet. So let's take a look at what is this advanced APM. So it's a program that includes cost and quality measures that are similar to MIPS. So they do kind of try and make the two paths of this program similar to each other. But an advanced APM also bears more than nominal financial risk. And we're going to explain that later on. But essentially what's going on is you're in this contract with CMS, and an organization bears this more than nominal financial risk. Now, CMS doesn't define whether it's the organization or the member. So you, for example, as a provider, can be a member of an organization that's considered an advanced APM. And CMS doesn't define whether it's the organization or the member that would bear that financial risk. They kind of very strategically decide to take themselves out of it and let the physician and the advanced APM square that out. But it does have to bear a more than nominal financial risk with CMS. Okay, now what is risk? I'm going to define what nominal means a little bit later on, but this risk is defined as a financial loss that is tied directly to your performance in an advanced APM. Now, a risk can be expressed in three different ways. For one, if the physician or if the eligible clinician does not do well with regards to these quality measures that they would report to under advanced APM, then CMS can withhold payment. Okay, they can also reduce payment. So if you meet some measures, not all, if you do relatively well but not well enough, they can reduce the payment to an advanced APM or the eligible clinician. And then lastly, if you don't meet the measures at all and you just perform very, very badly, CMS can make you write a check to them. So again, with regards to how much of that withhold or how much of that reduction or that check that you may have to write will depend on what kind of an advanced APM you're part of. But essentially, if the performance is not met, the advanced APM would owe CMS money or would have a reduction in payments, and that, of course, would translate into the provider that's participating in that advanced APM. So that's what they define as your risk. It's essentially a financial loss based on how well or not well you perform. So that was the first model of an advanced APM. The second model of an advanced APM is that as a medical home. So as a medical home, there's also a loss that's tied to your performance, but it's also tied to your expenditure. So if you, for example, spend more than the target amount, they can also reduce, withhold, or make you pay back that money. For example, it's a quality incentive as well, but your per member per month incentive is at risk. So let's say you participate in a standard medical home where maybe you get $8 per member per month, and that is for you to invest back into your practice. But if you perform badly, you have to pay that money back, and that qualifies as enough risk. So to qualify under this incentive, your per member per month payments have to represent a certain share of your Medicare revenue. So in 2017, that number is 2.5%, and that increases upwards. So that's pretty much CMS's idea of risk. And then in later years, starting 2018, this will only be eligible to physicians that are 50 providers or less. So if you're, in a medical home where you'll have more than that number of physicians, then this won't apply to you. And they really just did that, or they made this for physicians that are 50 providers or less, because that general definition that we looked at previously, this really puts small organizations at risk. So they kind of developed this medical home model that in 2018 will be applicable to only smaller practices. Okay, so before, in one of the previous slides, I had mentioned that an advanced APM has to bear a more than nominal financial risk, and so let's take a look at what nominal in this case applies, or what nominal in this case means. So a nominal financial risk, in order for an advanced APM to qualify as bearing that sort of a risk, an advanced APM has to pass 3 financial tests. So for one, it has to have a 30% marginal risk, or secondly, it has to have a minimal loss rate of 4% or less, and then lastly, it has to have a total risk of at least 4% of the advanced APM spending target. So let's take a look at what that means. Marginal risk, for example, if we're talking about a program like Medicare Shared Savings Program or an advanced or an ACO, that means that your sharing rate with CMS has to be 30% and include losses, not just gains. So for example, if a patient spends $10 above the benchmark, then you would have to pay out CMS $3, and then CMS would eat the remaining $7. So that's your 30% marginal risk. Your minimum loss rate, so a lot of these programs won't make you start paying CMS money if you lose like 50 cents or $1. The minimum loss tells you how much money you have to lose until CMS starts taking money from you. So that has to be 4% or less. And then your total risk of at least 4% represents the total amount of money that you have on the table. So it's pretty much the maximum amount that you can lose, and it has to be at least 4% of the APM spending target. So the spending target can also vary per month. Okay, so to kind of translate that, I've put this at the bottom of the slide, but you pay back at least 30% of the losses that are greater than 4% of the total cost of care or the total target price. So, if you have further questions about it, we can kind of help you play with numbers a little bit. And I think Justina has another poll question to throw out there for you.
The question is more of a statement, and we want to see what you think. The APM track is easier than MIPS. All right, so everyone seems to think that both MIPS and APMs are quite intimidating. There may be some practices that have already done meaningful use in PQRS, so maybe they think that MIPS is less work. At first, some providers that maybe are just learning about MIPS and realizing how much is involved in MIPS if they've never done meaningful use in PQRS before, maybe they might think APMs are a little bit easier, but after everything that Vita's gone over with all the risk that's involved, it's obvious that both APMs and MIPS seem to be quite involved and are definitely going to require a lot of attention from your practice.
Do you qualify in order to participate in an advanced APM? Well, that depends. So it's not just, I'm going to apply because that's the route that I want to do, and then if I get in, I'm going to be excluded from MIPS. That's not the case. You have to meet certain criteria in order to be eligible to qualify, and that criteria comes down to the number of patients and payments received and or the number of patients seen and payments received through this qualified advanced APM. So for example, in 2019 and 2020, you have to see 20% of your patients through this advanced APM. So that means that that advanced APM has to attribute 20% of the patients within your practice to your practice. And then 25% of the payments. And you can see that these numbers increase upwards and then kind of level out at 50% of patients seen through the advanced APM and 75% of payments received through an advanced APM. Now, with regards to attribution of patients, that depends. So CMS will probably look at your claims data and decide which patients are going to be attributed to your practice, or an advanced APM will actually take a look at that data and decide which patients are going to be attributed to your practice. So for example, if the patient has seen you as a provider for the last 2 of their visits, or if they've gone to you and then another provider, they're going to attribute that patient to the provider that the patient saw last. So it really depends mostly on your claims and the amount of times that the patient has seen you or who they've seen most recently, whether or not the APM attributes the patient to you. But just bear in mind that you have to meet the certain number of patients and the certain number of payments received through the advanced APM. So if you, for example, enter this year, let's say you start your participation in 2017, okay, that doesn't mean that you're excluded from MIPS, because if in 2019, when they're adjusting all these payments, they decide that you didn't see 20% of the patients through the advanced APM, maybe you saw 18% of your total patient volume through the APM or 17%, and if you didn't receive this 25% of the payments through the advanced APM, then they're going to backtrack you into MIPS. You not just have to enter the advanced APM, but you also have to meet this criteria in order to qualify and be exempt from MIPS. Now, in 2019 through 2020, it's only Medicare advanced APMs. However, starting 2021, private payers are going to adopt this model as well. So the best recommendation that we would have for you is start kind of assessing your practice now. Start taking a look at what's available. A lot more of the payers are going to start getting involved in this model. See what you need to do from your staffing, from your processes, from your technology perspective, and start making those changes now, because as I mentioned, an advanced APM, as long as you can meet the measures, is probably a slightly safer route because it's not a sliding scale. So obviously you'd want to perform well or meet the thresholds, but at least you're not compared to the other physicians. Okay, so let's take a look at the financial impact. Now, with an advanced APM, perhaps the most pronounced financial impact is the 5% lump sum bonus, and that's calculated based on last year's Medicare fee-for-service payments, and you can receive that every year for the first 5 years of the participation. So what they do is they give you this 5% lump sum bonus if you do well. And again, they don't compare you to the other physicians. They just simply want you to pass a certain threshold, and if you pass it or meet it, you get this 5% lump sum bonus, regardless of how far or below the threshold you are. Now, another financial impact is your growth in fee-for-service rates. So from 2016 to 2019, your fee-for-service will increase in 0.5% annually. The physician fee schedule will freeze from 2020 to 2025 and then start back up in 2026 by 0.75% growth. If you're a part of an advanced APM, your fee-for-service rates will grow at 0.75% starting 2026. If you're part of the MIPS track, it's going to grow by only 0.25%. So, I mean, this is another significant difference in your financials with an advanced APM as compared to the MIPS track. Not only do you get this 5% lump sum bonus simply for participation, but you also get the significant increase in your fee-for-service rate. But again, in order to qualify for all of this, you have to have a certain amount of your patients and a certain amount of your payments issued through the advanced APM. So it could, it could be, okay. So what are the specific advanced APMs available in 2017? You're going to see a list of 5 here, and 2 of these are slightly grayed out. The 5 that were available were the Comprehensive End-Stage Renal Disease Care Model, the Comprehensive Primary Care Plus Initiative, Medicare Shared Savings Program, Track 2 and Track 3 only. So that's something that I'd like to stress. If you're currently part of the Medicare Shared Savings Program and you're in Track 1, you are not exempt from MIPS. You'll get bonus points for participation in this, but you'll still have to do MIPS. The fourth one is the next generation ACO model, and then the last available advanced APM for 2017 is the oncology care model two-sided risk arrangement. And actually that starts in 2018, so in 2017 you want to make sure that you start the application process. Now, the comprehensive primary care and the next generation ACO, the deadlines for these have already passed. The comprehensive primary care, as the name implies, was only applicable to primary care physicians. And it was only available in certain regions of the United States because that's the only regions that had participating payers, but that is no longer available. It's a 5-year program and the applications for that have already passed. If you did apply and you're waiting to hear back, they said that you're probably going to hear back by Thanksgiving whether or not you got in. And if you have questions about it, time permitting, I'd be more than happy to address any questions on CPC Plus at the end of this webinar. The next generation ACO model has passed as well. That is also a several-year program, so they don't plan on reopening the applications for that. So the application period is ended. So that really leaves you with comprehensive ESRD care model, which is pretty much probably more for nephrologists, and then your Medicare Shared Savings Program and the oncology care model two-sided risk. For this webinar, I'm going to focus on the Medicare Shared Savings Program because that applies to a larger population than the other two remaining advanced APMs. But if you are interested in the comprehensive ESRD or in the oncology care model, we're going to provide you with our contact information at the end. Please reach out and we'll be able to work with you, with regards to demands and requirements of these two advanced APMs. Now again, just before we switch slides, I just wanted to make a note that Medicare Shared Savings Program Track 1 and PCMH do not qualify. So if you're currently part of one of these, make sure that you're still participating in MIPS. So let's take a look at the Medicare Shared Savings Program. The very first column here tells you what the definition for it is. So we looked at this already. In order for an advanced APM to be considered an advanced APM, it has to have at least a 30% marginal risk or shared losses with CMS. It has to have a total risk or shared losses capping at no less than 4%, and it has to have a minimum loss rate of 4% or lower. Okay, so taking a look at the MSSP Track 2, the marginal share loss is 40% to 60%. So because it has to be at least 30%, it's well over that. So with regards to this one financial test, the MSSP Track 2 qualifies. The total risk for MSSP is 5 to 10%, which is larger than 4%. So that is okay. And then the minimum loss rate is 0 to 3%, which is also great because it's lower than the demanded 4%. So by this general definition, MSSP Track 2 is a qualifying advanced APM for 2017. And then Track 3 is a little bit more risky because it's got greater share losses and it caps at a greater percentage. But it's also qualifying advanced APM. So if you are, participating in this already, great. You're part of an advanced APM. The only thing you have to make sure is that you see enough patients and receive enough payments through it, and then you should be good to go. If you're currently not, in MSSP and you're interested in being a part of an advanced APM starting 2017, this is something that you should look into. Okay. So I'm going to open up the floor for Q's and A's because I know that sometimes it can get a little bit confusing with all of these incentives and qualifications and all of these percentages. Just one thing that we wanted to throw out there very quickly, if you are going to choose an advanced APM route, you absolutely need an EHR system because all of these quality measures you're going to be extracting and submitting to an advanced APM are going to have to be extracted from your EHR. So pretty much the way it's going to work is, we've reviewed what you need to qualify. We've reviewed what an advanced APM needs to have as a nominal risk, and you're familiar with that now. But the way it really is going to work is that once you become part of an advanced APM, this organization that shares, losses with Medicare and has this total risk of no less than 4% and so forth, they're going to give you quality measures, and they're going to say, okay, I want you to report these to me on whatever, maybe it's quarterly, maybe it's annual basis. And so these quality measures are going to be very similar to those in MIPS. It's going to be things like, if you're a primary care patient, probably your hemoglobin A1C, whether you did the tests and what are the values and when were the tests done for your diabetic patients. It'll be things like immunization shots, like influenza. Did your patients, how many patients received these shots? So it's going to be these quality measures that you're probably already doing. It's just a matter of making sure that they're recorded somewhere that can be extracted with a report. And then you're going to submit these to this advanced APM, and they're going to see how well you do with these measures, or how evaluate what your performance is, and then submit these to CMS. And so CMS will decide whether whether an advanced APM that you're submitting these measures through is okay, or if they'll reduce payment or withhold payment, which is hopefully not the case. So one thing is that if you don't have an EHR yet, and you are interested in taking this advanced APM route, then make sure that you look into the options, and Justina can help you with those solutions. So is it too late to start? No. Just make sure that if you are interested in this, that you do so sooner than later. Okay. And then when do you start now? So I think I've already covered that. And then what can I do to prepare? So we tend to end our presentations with a slide that you need to, if you have questions, contact us. Make sure that there are people in your office or are accountable. So if you don't currently have like a MACRA leader or a MACRA super user, make sure you elect one. We typically recommend that not be a provider, just because providers are busy, they're seeing patients, and they're oftentimes too busy to research information online or make sure that they're following up with all of these objectives. If you have an office manager, that's probably the best person. There should be one person accountable for running reports, making sure that this data is being met, and for just kind of staying on top of all of the news tellers, attending webinars. There should really be one individual that's accountable for this. You do need a certified EHR technology, so if you have questions about what certified means, we'll be able to help you. Or if you don't have an EHR at the moment, you will need one. So let us know, and we'll offer you the solutions that we have, and see if one of these may fit you. And ask. So there's a load of information out there online. CMS is giving webinars. We'll have webinars, and we're available for you to contact us if you have questions, or if you're confused about anything, just reach out and let us know. You need our contact information or anything, you can reach out to any of us on the screen. If no one has any questions, then we'll go ahead and close the webinar here. This is the third of our series. We're going to have one more next Friday at dinner. Thank you so much for joining us today.